Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you a discussion with a really cool startup company called GYANT, and we're here with Stefan Behrens. He's co-founder and CEO of GYANT. Welcome, Stefan.
Hey, thanks for having me. Pleasure to be here.
Yeah, so I mean, you're working in a really exciting space given everything that's happening with COVID-19. But for those that aren't familiar with GYANT, tell us a little bit about yourself and GYANT.
Sure, I'm happy to. GYANT is a virtual assistant for healthcare. Think Siri for healthcare. We offer an AI-based solution that offers support and answers for questions and patients throughout their healthcare journey. And that includes figuring out for patients where they need to go next if they have a need for care, but also doing things like booking appointments, finding the right specialist, or providing answers for common questions that they have. We work as a B2B service for health systems, so we're helping them build out their front door on a digital way that allows them to deliver care, especially in the current environment where a lot of the care has shifted completely from virtual to from physical to virtual visits. And we want to make this as easy as possible and make the journey as friendly and positive for patients as we can. My personal background, I actually started two companies before this one in Germany, where one of them was in the video game space, the other one in the e-commerce space. So my background is almost entirely on the consumer side. And one of the main premises for the company was we wanted to bring some of those delightful experiences that we know from day-to-day life or phones and apps into the healthcare world and make it just a little bit easier for patients to connect with their care.
So has it been a delightful experience coming to the dysfunctional healthcare?
It's definitely been a learning curve. I think you need a little bit of naivete to even get started in a space like this, and grit and perseverance to keep banging your head against the wall until you see the first cracks appearing. But I think we're finally there with GYANT after almost 4 years. I see tremendous adoption of our technology with large names in the healthcare space, and I think the time is ripe for organizations to adopt these types of digital technologies at a much broader scale. So I think the banging against the wall has paid off.
Yeah, I mean, I've often said that I think the best strategy for a startup is some people that are from outside the industry that have some naivety, et cetera, and then also a couple people that, the old gray-haired people that can get you connected to the right people you need in healthcare. You combine those two, and it's magic. So, back to your product, like I think AI-powered chatbots and virtual assistants, they just sound really sexy, right? I mean, like it sounds, yeah, we all want that AI chatbot. Maybe it's Hollywood's done that to us. I don't know. But, break it down for people. What does it really mean from the perspective of GYANT? How does it, who buys this product at it sounds like you work mostly with health systems. Is it the marketing officer? Is it the CIO? Who's really kind of in charge, and what problem does it solve?
Sure. So let me start out by saying that first, behind the sexy, there's a lot of detailed legwork that goes into this. We spend years developing our.
Is that what you're saying?
Yes. So it's been years of developing our clinical and non-clinical natural language processing capabilities based on millions of patient interactions and make sure we understand what patients want to accomplish. Another couple of years validating clinical triage algorithms to make sure that our machine learning and subject matter experts that reviewed this, agree on where patients should go and where they need to be seen. And then thousands and thousands of painstaking, cases labeled based on anonymized health records and patient interactions. And all of that feeds into the sexy little product that, if I look at it, still has so many limitations and so many areas where it should grow, but already at least does a pretty good job at the core tasks that patients throw at it. We typically work with either the marketing department at a health system because they control the website and a lot of the patient-facing assets. So they're looking for ways of making it easier, or it's part of the digital transformation teams that a lot of health systems have set up. So it's maybe chief innovation officer or chief digital officer, and in some cases, they have created departments for consumerization of healthcare to make it easier for patients to access their care. So those are typically the starting points for us, and we work with our partners to figure out what other parts of the organization, because this involves almost the entire health system organization, from medical business units to patient access and the contact center, to the website, to IT who needs to support it and support EMR integration. So it's typically a broad effort that involves a lot of different stakeholders.
Yeah, I mean,
And
I think, go ahead.
go ahead.
Yeah, I was gonna say, I think that is the challenge with this type of product is marketing owns the website. The CIO knows nothing about it, or nearly nothing. I've seen that firsthand from CIOs in most cases, and yet you need the clinical person involved, or marketing won't touch it with a long pole because they're like, this is kind of making clinical decisions, and how do I deal with that? So I think that becomes a real challenge. And as we've seen, I am the founder of hitmic.com, which is a healthcare marketing community. Marketing people over here, CIO, tech people, medical people over here, probably a third group, right? And there the two should meet in many cases. So I think that must be a real challenge.
Yeah, which is interesting, because we see that same stakeholder complexity reflected even in the small scope of our company, right? We bring together people who understand the consumer space, user experiences, and the marketing side of things, with the tech folks that need to support it and build it, and the machine learning infrastructure that goes with it, and the clinical team that needs to make sure that our products are safe, and that the clinical stakeholders that are customers that are kicking the tires will find reassurance, because we have established quality management procedures and risk management processes to make sure that all of this is safe for patients to use. But I would say one of the biggest challenges actually that our customers face and that we help them solve is that over the last couple of years, in their efforts to become more digital, they've built up this complex set of pieces that are making up their infrastructure. And you have all of these different tools that are often like individual point solutions for smaller problems or use cases. And now it's actually getting pretty difficult for them and their patients to kind of sort out how this all ties together into a seamless journey. So what we're doing with our customers is essentially being that glue that glues together these individual pieces, so that you can have everything in one seamlessly accessible interface, where you can simply just answer a question like, how can we help you? And then whether you have a mental health complaint, and then we guide you to the appropriate services, or you're trying to connect with a doctor and we look up the provider directory and then present you with specialists that meet your needs, or surface appointment slots for self-booking. There's a lot of different things that we're tying together into one experience. And so there's a big effort on our side to work with our customers on integrating all of these different pieces of infrastructure they already have into one seamless experience and bringing that to the patients.
Yeah, and I read somewhere that you think data integration, and really I think largely that's the EHR, but I'm sure there's other ones, is a prerequisite for true innovation. So why do you place such an importance on that kind of EHR integration, having the EHR data available? What does it allow you to do having that data?
Yeah, so two-part answer. I think on one hand, it starts with the EMR integration, because for a lot of our customers, that's the main tool that enables their clinical workflows. So if you want to make a difference on their operations and drive efficiencies, you need to be addressing and working with the EMR, because that's where the work happens. And the second part is that that's also typically the single source of truth, for information about a patient, what happens to them, what happened to them in the past, what kind of medications they're taking, what happens next. It all needs to be documented in there. So for us, the EMR integration unlocks a lot of new opportunities to improve the patient journey, for example, through personalization and offering and having kind of context awareness of what happened prior to your interaction in your care journey. And for the health system, it's additional efficiencies that you can unlock through workflow support, like chart population and driving decision support inside of the EMR, and taking care of a lot of manual work that is currently happening through nurses or front desk staff picking up the phone and reaching out to patients, and automating large chunks of that and feeding it back into the EMR, and only escalating those cases that need to be handled as an exception of the rule, and bringing that to the appropriate resource. So the EMR is where it all starts, but that's not where it ends. There's also contact center access software, if you want to connect directly for live chat to a patient support agent or a nurse, so you need to integrate with Cisco or Salesforce. There are partners for telemedicine like Teladoc, Amwell, or MD Live that you need to integrate to deliver virtual care. There are mental health services like Silver Cloud. There's provider directories of different kinds. So you need to bring a lot of different things together and tie it into one experience. So integration-wise, it is a challenge. But that's also where a lot of the value lies, I think, in what we can provide for our partners, because that's where things get interesting, is like tying all these different pieces together and making it a seamless experience. That's really where the value lies for the patient and also in turn for the health system.
Yeah, that goes back to what you were saying as far as having multiple systems and how do you tie them together. It's interesting during COVID-19, it seems like you pivoted maybe a little bit. I mean, everyone pivoted during COVID-19 really to kind of take care of the customers. Tell us a little bit about what you did in your, to help organizations amidst the crisis.
Yeah, I mean, as we're working with our customers, it's important for us to kind of stay in touch with their immediate needs, and those immediate needs changed significantly in March, all of a sudden. So we quickly worked on adapting our virtual assistant to the COVID use case. So we taught it how to differentiate and triage cases based on symptom presentation, exposure, travel history, although travel history no longer makes a difference now, but at the time it did. And then identifying what are some of the key questions that people are calling into their doctor's offices for, right? That we can address in an automated way to take that load off of the contact center or the phone lines. For one of our partners, for example, they had a good 3,000 calls coming in on a daily basis. And by deploying our solution to their website and answering a lot of these questions in an automated way, we were able to cut down the call volume by over 1,000 calls per day. So that significantly helps redeploy resources to frontline care and make sure that patients can get their answers immediately at any time of the day, and not just when the contact center or the front desk are open between 9 and 5. So we build a solution that offers screening and care navigation support and these FAQ answers. And we quickly rolled that out, I think now to like 25 different partners over the last couple of months. We've seen, I think, a good 400,000 users. So patients interact with our tools across these deployments in the last couple of months. We've completed over 300,000 COVID symptom screens that resulted in a recommendation either for testing or staying home and quarantining in place. And we're now working with our customers on how to safely open up for business. Revenue recovery is one of the biggest topics for a lot of our customers now. So we're trying to work with them on including COVID screens and other screens in the process for scheduled visits and scheduled procedures, so that they don't have to hire additional staff to make these outbound calls to check patients before they come into the office.
Nice. And so do you have a proactive element to outreach to the patient, or are you mostly the AI assistant on the website? Yeah, like can they integrate it into email campaigns and things like that, or how do you approach those?
Yes, yeah. So there are a lot of different ways of how you can string a patient journey together. I think the most prominent use case for us was this kind of reactive one where it sits on the website or inside the patient portal or inside of a patient-facing app, and patients can interact with it on their own time. But increasingly now, we're working with our customers on a proactive outreach. So for example, a day or two before your scheduled visit, you would get a text message where you click a link and then you essentially start the assistant in your browser on your phone, and you go through this a screening protocol, but you can also ask questions that can be addressed right then and there without you having to pick up the phone and talk to a person. In many ways, I believe that is an important complement to this kind of reactive way of addressing when patients come in, is this proactive outbound. There's a lot of opportunity there to leverage this type of technology for additional use cases, and that's what we're working on this year and next year, to bring that into more and more clinical use cases that can leverage this technology in a meaningful way to save time for health systems, but also make things a lot easier to navigate for patients. So think of an assistant around diabetic concerns, or maybe post-chemotherapy, watching symptoms and answering your questions around potential side effects and things like that. So there's lots of different use cases here.
So, I have to ask this. On the website, what are some of the common questions and what are some of the outrageous questions that, because I bet you get a lot of interesting questions there. And I assume if it doesn't know the answer to the question, then it just escalates it to a call center or something like that. Is that, and so yeah, what are some of the common things that, oh, we can nail these types of questions? And what are some things that you're like, I couldn't believe we got asked this. You know any?
Yeah, I mean the common things are the easy ones. So it's either direct symptomatic complaints, right? My I have a fever, my son is sick, I'm my eye hurts or my head hurts. Those are the simple things. Then there are typical non-clinical topics like I need help paying my bill. Does my insurance cover a particular procedure? What's
Right.
my out of pocket for a visit? How do I schedule an MRI, right? It's those types of questions that patients are looking for help for. But then there are always also surprises. For example, with one of our customers, it was before Christmas time, and there was an interesting spike in the number of utterances and intents that we could not handle at that point, which were related to Secret Santa, because they had a volunteers program where patients, where people and volunteers could come into the hospital and play secrets, play Santa Claus and give presents to kids in the pediatric hospital, for example. So
Uh,
we quickly added that. We did not expect, for example, just the amount of interest people have around jobs, right? So it's not just patients that come to hospital website, but there's also people that are looking for work opportunities. And so, over the last 6 to 9 months, we've built out a large library of additional intents that we didn't, know how to handle well before that we're now addressing.
yeah.
But that's always work in progress. The first, the first 20% of intents probably cover 80% of the volume for patients, right? So it's an 80-20
Right.
rule, but then the
Yeah.
long tail is really long.
I can imagine it. And then you get, Secret Santa, I imagine there's tons of programs like that that come up that, are just individual programs you probably will never see again, but you need for this 1 month time period, a race or something that they do. That makes sense. Interesting.
Yeah.
So what is the big
And
vision?
and
Go ahead.
just one more thing, like another question we often see is related to, are you real? Are you a human? Right. So it's like some people are interacting with this as if they're chatting with a human. So that's another frequent one that I think is
Yeah.
funny sometimes. Yeah.
Could they ask him on a date? No, I'm just kidding. Alexa, she's a member of our family, so I think we're all becoming familiar with it, right?
Yeah, I think actually that's we build answers into our assistant to address certain topics like this. For example, when you say "I love you" or "I hate you" or "you
Uh-huh.
suck," we actually handle those intents specifically with a somewhat witty response, because we feel those are elements of people just like testing out the limits of a new technology, right? Just like when you first got Alexa and you start talking to her, you also ask questions to see what she can and can't do. And I think it's just part of people experimenting and getting used to a new technology.
Oh, I've told Alexa to do better many times, so but no, I love it. It's a great technology. So what is the big vision that that you see of what you're trying to accomplish at Giant?
Yeah, so as I mentioned earlier, my original background's on the consumer space, and I think what we've seen happening there, across broad industries was, things that used to be complicated are now much easier. There are 3-button clicks on your phone. You have very intuitive interfaces that don't require a manual. You give it to someone and they intuitively understand how to interact with it. And that's the kind of ease of use that we want to bring to healthcare. And that's not just an interface, that's also in making some of the processes that are very complicated and cumbersome and require different handoffs and multiple calls, make those easier for patients so that they can get what they need. And in the process, unlock a lot of efficiency and opportunity for cost reduction as well in the healthcare space. So I see this as this big gap between patients on one side and their provider organizations on the other side. Right now, there are a lot of individual fragmented communication channels between them, but they're not integrated. The left hand doesn't know what the right hand is doing. You get these stacks of paper with discharge instructions that most people probably just skim and then put in the bin. If we can make all of this information so that it's relevant for you personally, instead of just a printer of 50 pages that applies to everyone, and where you can ask questions and make it interactive and put it all in the same channel so we have context awareness of all the different things that are going on. I think we're going to make it significantly better and more relevant and more helpful for patients, and at the same time cut out a lot of the expense on the health system side to allow us to do more with the same resources and bend the cost curve in the long run. So if I'm looking at this, communication sounds easy, but I think there's the potential to automate large elements of care navigation for people, which is kind of what we're doing already, but there's potentially also an opportunity to automate some of the care delivery. If you think about asynchronous care and virtual care, assistants can play a bigger and bigger role there. Chronic disease management, care management, there are a lot of opportunities where you can put a lot of these processes on autopilot to some extent, and then only bring in a human resource when needed, where needed.
Yeah, I think it's a huge opportunity because, and I think it's been made more so with the expansion of telehealth, et cetera. I mean, we have so many care options and knowing where to go and what to do. As a parent of 4 kids, I've dealt with it a lot, and it's hard, right? And so I think we want AI assistants to help us make that decision easier. And yeah, I think there's lots of other elements, as you said. But thanks for sharing your vision for it. If people want to learn more about GYANT, where can they go?
Yeah, so you can start at our website, but in either case, feel free to reach out by email if you want to get in touch or have questions. It's Stefan, Stefan @gyant.com. So happy to get in touch with people who want to learn more.
Yeah, and that's GYANT, GYANT.com. So that should be good. Thanks, Stefan. I appreciate you sharing these insights, and thanks everyone for watching. If you want to find more great health IT content like this, check it out at healthcareittoday.com. Thanks, Stefan.
Fantastic. Thank you, John. Pleasure to be here.